All right, I'm going to start because we like to start on time, respecting everyone's time. I'm Dawn Ellison. I'm in the core group of Healthcare Reinvention Collaborative. And our other core members on the call today are Denise, and Keely is coming in soon. I see her trying
Yep.
again. She was having trouble with Zoom.
She's in.
And Paul Behrens and Jennifer Beach is here as well. Yay, good to see all of you. So today we're fortunate to be shining a light on the work of a couple of our network members, and I'm going to introduce them to you here in a moment. And you will recall that our mission is to identify, connect, support, and illuminate every healthcare change maker. So we're really excited to be doing our second Shine a Light event today. I'm going to share the agreement slide with you if you'll hold on one second. I'm going to pull that up. So we like to use these. This is kind of an abbreviated list of our agreements. Stay curious. You will see the next one in action. It is ask for what you need, offer what you can. Cameras on as a default. If you have a reason to have it off, of course, um, be most comfortable. Share your thinking over your inclusions. We find that when you can share your thinking over your conclusions, you can find more in common with other people's thinking. Speak with intention and listen with attention. So listen to understand and speak to the essence. All right. Those are our abbreviated agreements that we like to work with. And we're just really happy to have our three guests here today. They will be given approximately 10 minutes to describe their work, and they will also ask for what they need from our community and offer what they can to the community. So while they inform us about their work, please feel free to let them know what you can offer them, as well as what they might offer you in the chat. So while they're speaking, if you can put your comments in the chat, that'd be great. And because I want to be sure we have enough time to get all our guests in and then have a rich conversation. So when each guest is finished speaking, I will introduce the next guest, and we will continue until all three have had a chance to describe their work, ask for what they need, and offer what they can. When they're all three finished, I'll open things up for a conversation, at which time you can ask more about their work, discuss possible collaborations, or just express appreciation for what they're doing. Dr. Athena Hall. She is a pediatrician and founder of Xena, a network dedicated to transforming healthcare from within to a more community centered, relationship driven system. With a background in global health, she has a passion for health equity and community inclusion and sees these elements as foundational for a healthy system. Athena, please tell us about your work.
Yeah, thank you so much. Yeah, so Xena is a network to bring people together across sectors within healthcare and outside so we can shift the healthcare system on a foundational level. So a little bit about me. I am a pediatrician. I live in Seattle, Washington. I'm in hospitals and urgent care. I went into medicine actually because I have a passion for global health work, and I felt really drawn to learning about healthcare systems. And I did a global health fellowship right after my residency training, where I saw a lot of the problems in our healthcare system with its hierarchical nature, with providers knowing the most about health and patients knowing the least. I also saw how communities weren't included in our decisions about the services that were being provided. And we were pushing a one size fits all Western healthcare model on these communities. And I also saw that it was a disease management system rather than a system that is promoting health from a prevention side. And so one quick story was there was a mom who had a child in the hospital. In order to pay for his treatment, she had to sell a big chunk of their land and all of their family's animals, as well as stop feeding two of her children. And it was really disturbing to me at the time. But then I also realized in the US that we have we have 2/3 of bankruptcy cases due to medical debt. And the sacrifices that people have to make in order to care for themselves and their loved ones is enormous in this country. We're also not listening to our communities and including them in the decisions around what services are provided to them. And we are really putting out fires in our healthcare system rather than preventing them in the first place. So coming back to the States, I felt pretty isolated and powerless to make any changes on my own. So I started building Xena so that I could bring everyone together. I know there are other passionate people out there who want to advocate for a more human-centered healthcare system. So everyone here knows that people are ready for change in healthcare. We have almost 50% of healthcare workers reporting feeling burned out, and majority of Americans report that the healthcare system is failing to meet their needs. It's very costly, the quality of care, it's really convoluted, and there's just so many issues and needs that aren't being addressed within our healthcare system. So the vision for Xena is a healthcare system that puts people and communities first. It builds strong relationships, and it cares for the whole person. Our mission is to bring healthcare workers and communities together so that we can collaborate and create meaningful change in healthcare quickly and effectively. The problems that Xena addresses is burnout and disengagement within the healthcare system. I believe that the root of burnout is a misalignment in values. A lot of people came into healthcare because they want to help people and see people getting healthy. And our system gets in the way of that a lot of the time, and sometimes even causes greater burdens than what the person started out with. So within Xena, we will be working on projects together that will reignite your passion and purpose if it's aligned with your values. So Xena also addresses the fragmentation in our healthcare system. So we'll be collaborating not only within healthcare with physicians and nurses and social work, also across sectors, people that are lawyers and patients, people from all areas who have a unique perspective, and we need to hear their voices, and we need to work together so that we can build a better healthcare system together. And Xena also includes the community's voices. We're going to be learning about how to engage with our communities and how to include them in our decision-making process from the beginning of our projects all the way through to the end. So Xena is for healthcare providers who are wanting to grow professionally as leaders, who are also healthcare professionals who want to collaborate with others and feel a strong connection to their work. Xena is also for community members who are advocating for equitable, accessible, and whole person health. This is just some research. The Robert Wood Johnson Foundation showed how important community engagement is. And we know that providing whole person health, looking at the whole person, really promotes health equity and improves outcomes. So Xena is a network bringing us all together. It's both a learning platform and an action network. So we are kicking off Xena with bringing in guest speakers who are going to be talking about their programs that are successful in improving the health of their communities. We'll also be bringing in guest speakers who are knowledgeable about how to build relationships with both healthcare providers and patients, and between the healthcare institutions and our communities. We'll be bringing in all kinds of guest speakers and then have different courses and workshops. And we're also going to have things like grant writing workshops and things so that we are more effective when we go into the action side of the network. We are choosing our pilot project currently, and we'll be kicking that off by the end of the year and learning from it so that we can scale our projects outward in the future. So this is kind of what I was just talking about, what we do. And Xena is, we have a discussion board where we can all discuss what we're passionate about. We all have different niches and different things that we're drawn to, and we have different perspectives. So there's so much that we can learn from each other. And there's also a lot that we can learn from what's already working out there, what solutions are already out there that we can learn from and implement in our projects. And so there is a community access tier that is free for anyone. You can come in and hear what we're talking about, be a part of the conversations, and as well as join our monthly meetings and have access to some of our guest speakers. The Innovator Circle is currently free, and then it will be $150 a year after we have built it out more. But the Innovator Circle is where we are going to be working on the projects together, and you'll have more access to resources and different courses and trainings. So this is what I was just laying out for everyone. This is what will be in the Innovator Circle. And our Innovator Circle also, as we're working on the projects, we're going to post in the community side so you can learn about our progress. We can ask you questions in the community and get support. And if people want to donate from the community towards a certain project, then they could be involved with that. So some of the projects that we may have would be emotional intelligence training or leadership training of healthcare workers. We will have some projects to scale established community-based programs and expand access to mental health resources. And some of the projects may be looking at bringing in integrated multidisciplinary clinics or care teams. So this is just a rough timeline. Initially, we're just now bringing in new members and building engagement, and we'll be launching our first workshops and bringing in some guest speakers here soon. And mid-year to fall, we'll start our pilot project and just start building the groundwork for it. And by the end of the year, we'll take a look back and revise the platform as needed. So some of the support that I'm needing is ideas and insights on funding, as well as partnerships with other networks and people who are change makers in healthcare and outside of healthcare, and then also just help in bringing in new members. I'm going to be starting as a speaker, and so if anyone knows, has any connections to get me on stage, I would love that as well. So this is my contact information here with the website www.athenahealthnetwork.com. And you can find me on LinkedIn at Athena Lauren Hall.
Yep. All right. Thank you, Athena. That is a big challenge that you have ahead of you. And there's a lot of people in the community that I know are going to be important for you to connect with. So let's move on to our next guest, which is Lonnie Hirsch. Lonnie is a seasoned healthcare leader who previously founded and owned a full service healthcare marketing agency before establishing Forefront Healthcare Consulting, where he leads a consortium of independent consultants serving healthcare providers, insurers, and self funded employers. As a co catalyst of Healthcare Reinvention Collaborative, Lonnie is dedicated to advancing proactive disease prevention and early intervention strategies to help people avoid and recover chronic disease. I reached out to Lonnie because I heard that he was doing something around Medicare, and he's going to tell you more about his work. And I'll turn it over to Lonnie.
Well, thank you, Dawn. Thanks for inviting me to share what I'm focused on and working on right now, which is actually the impending budget cuts to Medicaid and the massive impact it's going to have on all Americans, not just those who are currently receiving health care through Medicaid. I expect that many of the people here today already know a lot about what's going on as it pertains to threats to Medicaid, but let me share a bit more context just to be sure we're all on the same page. Medicaid cuts are coming. It's not official yet, and specifics of the cuts have yet to be determined, but funding and grant cuts will happen. The grant cuts are already happening. And my view and that of some others that I coordinate with is that just waiting for this inevitable shoe to drop is really irresponsible, as well as buying into a powerless victim mentality. Medicaid and CHIP, which is also at risk for cuts, cover healthcare for millions of Americans and not just those below the poverty line. For example, Medicaid covers 63% of all nursing home residents, and CHIP, which is the Children's Health Insurance Program, provides low-cost health coverage to children in families that earn too much money to qualify for Medicaid, but don't earn enough to really be able to provide the kind of healthcare coverage that their children require. So one of the more likely scenarios for these cuts to Medicaid funding is that the federal government will reduce its share of the funding of Medicaid expansion. Medicaid expansion, for those of you who may not be as familiar with it, began in 2014 under the ACA, and today covers around 25 million people in the US, including adults earning up to 138% of the federal poverty level. So the expectation is that rather than simply ending the program, it's more likely that Congress will reduce its share of funding under Medicaid expansion from currently what its share is, which is 90%, to match the funding share for all other Medicaid beneficiaries, which across the country probably averages closer to 50%. And so the states will be left to decide how to make up that shortfall. Well, that likely means many people who are currently covered and qualify for Medicaid under Medicaid expansion will no longer be covered. In fact, there are 12 states in the US that already have trigger laws in place that would immediately shut down all services to those currently enrolled in Medicaid through Medicaid expansion, concurrent with a reduction in the percentage of funding by the federal government. Now, if you combine that with the risk, maybe more the likelihood, of ACA's enhanced subsidies expiring at the end of this year without being renewed, that's millions more Americans who won't be able to afford health insurance at all. So where will they show up for care? Well, if they don't have to, they'll postpone, they'll defer. And if they do have to, they'll go to the nearest hospital emergency department that they can find for charitable care, which will increase waiting times dramatically for everyone. And the hospitals impacted by these cuts will respond by cutting staff, which will further increase waiting time and decrease access. And if you add to that the fear that many Medicaid recipients who are either undocumented or paranoid that they will be inaccurately miscategorized or will expose family members to additional risk, and who, as a result, will defer care as long as possible, many of those will also end up in emergency departments. Reliance, as has been the case, on governmental bodies to keep patients and providers informed has already been effectively interrupted. And many Medicaid beneficiaries are afraid, confused, lacking information, and have little reason to feel confident that public officials will do much, if anything, to protect them. Some of you may know that there was a town hall held last night in Scottsdale, Arizona, with Arizona Democratic Senators Mark Kelly and Ruben Gallego. And from what I could glean from the coverage of that meeting, the senators had few answers beyond encouraging citizens to make their voices heard. Access is the Medicaid program in Arizona, and it serves 2 million Arizonans, and over 500,000 of those are eligible for access only through Medicaid expansion. So you can see the impact even in a single state. Hospitals, skilled nursing facilities, and other safety net providers are going to have to cut staff, which affects all patients, not just Medicaid beneficiaries. And so it's the view of people that I'm working with right now that those who are in the safety net ecosystem really have to take ownership of their own strategic planning and communication strategies to patients, as well as to payers, to community advocacy organizations, and to other NGOs. In fact, there's a strong argument to be made right now that the window of opportunity to be proactive in outreach by safety net providers to Medicaid and CHIP beneficiaries is between now and the end of this year. Unfortunately, most of those constituents, most of the stakeholders who are doing any contingency planning are essentially doing it in their own private silos and thus in a relative information vacuum. And it's our belief that we can learn from and adopt best practices from each other and from groupthink. So there are a few people that I'm working with closely right now. Sally Mildren, who some of you know, is one of them. There's another gentleman named Michael Marchand, who until the beginning of this year was working in the Office of the Insurance Commissioner for Washington State. And we're working on developing a third-party, unbiased intermediary to connect these safety net stakeholders in more effective care coordination, collaboration, and communications with each other and to their constituents rather than continuing to try to figure it out on their own. We're going to start with the Medicaid safety net provider organizations, talking to each other and learning from each other. And we're anticipating setting it up in a way that even if they don't feel comfortable sharing strategies with each other in a public forum, that we can provide a conduit so that they can share strategies and plans without attribution. And if they're willing to meet as a group in virtual public settings, so much better. Once we establish a foothold there with the provider organizations, that would include hospitals, critical access hospitals, rural health, free federally qualified health centers, and other organizations that provide healthcare services to a disproportionately high number of Medicaid recipients. We're expanding that circle, and we intend to include Medicaid managed care organizations, the insurers that are more heavily committed to Medicaid, as well as state Medicaid agencies and community NGOs. So with that in mind, as it goes to how can you help? Well, we're going to start with a focus on the state of Washington, where Sally and Michael and I already have some connections and experience, and we know that there are others, some others at least, who are involved with HRC that are also pretty well connected in Washington State. But it's essentially where the pilot of this effort will be set up. And we need contacts and introductions at this point to C-suite executives in rural hospitals, critical access hospitals, FQHCs, as well as some executives in larger urban hospitals who are also going to feel the effects of Medicaid cuts in their emergency departments. Preferably if anybody has those contacts in Washington State, where we might not and could arrange any introductions, that would be extremely valuable. Our goal is to expand this effort to other states, but we first need to prove to the safety net ecosystem stakeholders and, frankly, to ourselves that this is possible, which is why we're starting with Washington first. So we're happy to engage with these individuals privately or in small group discussions if they're willing to share in that kind of forum. I know that part of this discussion is also what we can offer to HRC and its members. And I would just say for me personally, as somebody who's had a long history in communications and marketing, I would be able to help where I can in providing ongoing communication support for people in HRC who are trying to get their message out. I've got a pretty good network, particularly on LinkedIn, and so networking and introductions where I can be helpful is something I certainly would want to offer to anybody in the HRC network. And also maybe some marketing guidance if some of the efforts that some of the HRC members are working on could benefit from some of what I've had in terms of my experience over 35 years in marketing and communications, specifically in and around the healthcare industry. I'm happy to have those conversations as well, and appreciate everybody's time and being able to be here today.
Thank you, Lonnie. This is such important message to get out, and you communicate it so well. I really appreciate that you came and shared that with us today. Next, we have Keely Gales, and Dr. Keely Gales is a physical therapist, a wife, and mother, as well as the founder of Health for the People. Health for the People is the result of a deep belief that Americans are capable of great things when we find common ground and put our heads together, and that finding a solution for healthcare is not beyond our capacity. Its necessity has been reinforced by her personal experience as a patient, a caretaker, and a clinician. Keely, please tell us about Health for the People.
Hi, everybody. Thank you, Dawn, for that wonderful introduction. And I have to say thank you to Athena as well for setting all of the beautiful groundwork. I believe that our work overlaps a lot, and I look forward to meeting with you at some point after today. So my story is that I am a physical therapist, and while I was in my graduate training program, was when my eyes were finally opened to all of the difficulties that we really face as a healthcare system. And I couldn't believe that I hadn't really confronted it until that point. So that spurred my capstone project, which has now turned into this nonprofit organization called Health for the People. And it looked a lot like what Athena is trying to do right now when the concept first started. And it has morphed since then in the last 8 years or so into a little bit more specific plan to attack the plan, if you will, for what could healthcare look like in the future. So I don't know about you, but I'd like to have a little bit more than a concept of a plan to move forward with. And I realize that we live in such a heavily divided country that the thing that has really impeded our ability to make progress in this arena, in large part, is public opinion and understanding of the true issues and why we are not making progress. So I think a big education component is necessary for the masses. And I'm hoping that work like what Lonnie has been discussing with reaching out to organizations who are treating patients that have a lot of Medicaid is going to be a part of that solution as well. But what our organization is doing is really trying to create a space where we can specifically focus on talking about what do the pieces of that plan look like in a way that breaks down silos by creating different, I hate to say silos, but different organization of thought, right? So rather than having all of the ER docs in one room, what we do is we take somebody who represents emergency medicine, somebody who's a pediatrician, somebody who's a nurse and a PT and a lawyer and an accountant and a patient experience representative, and put all of those diverse perspectives in one room or one space to talk about a specific issue. And it might be like what Lonnie's working on right now, like Medicaid, but in my goal, it would be more talking about those things as near-term solutions, but also really focusing on if we had that pie in the sky, or as close as we can reasonably expect to get to that in this country, what pieces could we put in place to make that the most successful? So if you go to our website, healthforthepeople.org, you can find the plan that I've put together through a lot of listening work. And that listening work occurred over a number of years, just seeing what is out there that is working, whether it's domestically or abroad, that could solve for some of those big issues that we are encountering in this country. Because the truth is that the solutions already exist. We just aren't doing a very good job of implementing them. And in places where they are being implemented, it's small region, right? It's on a smaller scale, whether it's a city or a state or a clinic level. And I want us to expand on how do we take that concept and make it something that could be feasible nationally. And like both of you have said, right, we need that group think. We need diverse perspectives in order to take this mountain, right, and start to make it into a molehill. Because the truth is, it is going to be incredibly difficult to reform our healthcare system because it is deeply entrenched. But that does not mean it's impossible. And I think that what we have to recognize is that healthcare affects every single one of us. So we want, sorry, Susie made a comment that made me laugh. What we want is to take the concepts and make them small enough, but while not losing sight of the end goal, right? How do we work together to attack each of these individual issues. And so we need to work with organizations who are already doing this work. My goal is to be able to bring in people like Athena, like Lonnie into this space and let them find their niche and have those conversations around a concept that will help us start to flesh out what is the best way to attack each and every one of those topics. Now, I have put forth, I believe it's about 15 solutions, if you will, that mostly I did not come up with. There's a couple that are somewhat my brainchild, but as anybody who's ever thought they came up with anything recognizes, somebody probably did it and you just didn't know it, right? My concept really, though, is that they need to be implemented either at the same time or in a stepwise process, because without one of them in place, many of the others don't really work. And that is the hard part, is recognizing which of these have to be implemented at the same time, and how do we work the system, right? Like, who do we need to know to figure out how do we actually work the existing system in order to be able to get these what should be common sense solutions to move forward. And so I've been networking with people like Rick Mountcastle and Denise and Todd Otten and everybody over the last few years, trying to get to that point where my network is broad enough that I can bring in those creative minds. And that's still my ask today, right? Is that we really still just need people. I will be very transparent in that over the last year, I have become a parent once again. And so my work has taken a little bit of a slump as I was preparing for having a baby and had the baby. And the organization has shrunk to some extent as well, because we were female led. And unfortunately, in this country, we don't have the luxury of having paid maternity leave. And so we really need people who have, either or time or treasure, right? Whether you can, we need at least one board member, and we really need volunteers or people who are just interested in collaborating in the space to get the conversation going. Just as Athena was saying, right? It's all great to have this space, but if there's no people in the space having a conversation, it doesn't get very far, right? So that's why I show up to meetings like this. And we need more people who are willing to just do that, just keep connecting and bringing people in. There's always other work to be done, and whatever skill set somebody has that's interested in working with us, we can always find a way to put it to great use. We'd love to meet somebody who has some legal acumen, as well as financial backgrounds. If you know anybody who has a passion for the kind of work that we're doing, you can learn more about the specifics of our projects on the website. We do have a local initiative as well to try to get some resources directly to the people who need them in our community. But the fundraising we've done to date has often been earmarked toward that cause. And so it does make it difficult for us to get like the national campaign moving forward, when most of the money that we have, people just want to see it go to help one person in the community. And I hate to poo-poo that, because it is important to be treating people on a local level. But if we don't do something about the big picture, we're not going to have the small picture that looks anything like what we expect it to look like, in my personal opinion, in the near future. So if you're interested, I ask you to reach out. I'm happy to share any and all of my contact information and figure out a way that we can collaborate and make each other's work more sustainable and easier. So thank you so much for your time, and I hope I answered all of those points. Feel free to ask any questions when we wrap up here.
I for sure heard your ask, and
What can I
want to
offer?
make sure. I just want to make sure that you have a chance to say that.
Thank you,
Make
Dawn.
sure that's clear to people.
Yeah, what I can offer is what I have done so far, right? So I have done a ton of listening work, and I love to talk. So if anyone's at a point where they're trying to figure out, are there point solutions for specific things? If you see that I've touched on it in my outline, I probably know other organizations that are connected to that particular thought process. And I can tell you where that came from and maybe point you in the right direction of more resources. I'm working with one organization right now as an expert, as a physical therapist who does pelvic health, just to help them vet people who might be providers for their organization. So any way that I can help, I'm always willing to help. And if there's anything in my background that makes you think that I might have a skill, please just reach out and give me the ask. I like to be a connector, and I don't have quite the extensive background that Lonnie does, so I don't know that I'm as good at it, but I never am unwilling to reach out to someone. If I have to cold call them, I will cold call them to make things move in the right direction. So please just always ask.
Thanks, Keely. And I want to emphasize the Health for the People website is a great resource to get a lot of great information. She has put a lot of time and effort into this, and it's really good work because she's got a great mind. So I really encourage people to check that out. So thank you to all of our Shine a Light guests. I really appreciate the work that you're all doing and that you were willing to be here today to share it with our community. And now I want to welcome everyone to open their mic. And if you'd like to ask more questions about anyone's work or express appreciation for their work or ask what you need and offer what you can in order to spark collaborations, please, this is the chance to do that. And I know there were people in the chat that were itching to ask questions and make comments. So I'll open it up to that right now. Yes, go ahead,
I'll
Mindy.
get started if you would like. And that
Thanks.
is just to
Yes.
say I am in awe of all three of you and the work that you are doing and the difference that each of you are making. And I appreciate you coming on today to talk to us. That's what I was going to say.
Thank you, Mindy.
Thanks, Mindy. I know somebody asked, what does ZNA stand for? Athena, that's for you.
Yeah. Xena or ZNA, I heard the name. It was a woman that I met, and as soon as I heard that name, I felt like it fit what I was trying to create, which is shifting the health of our communities and really ZNA is like future DNA. So shifting their health on a foundational level. And so we can all start feeling like we're out of survival mode and we're able to live healthy lives that feel meaningful.
Athena,
Thanks, Athena.
if I may, I heard one thing when you were speaking that really got me excited, which was talking about the reality that Western and Eastern medicine approaches, or alternative, whatever you want to call it, have been also put into silos a lot in this country. And I love the approach that you're taking on trying to make sure that we are thinking outside the box or bringing in things that have much longer histories than Western medicine, really and truly, whenever we're trying to find solutions. And that's one of the things that I'd like to do with Health for the People as well, is when rethinking what could it be, how do we weave in appropriately these other forms of medicine into wellness overall in a way that's seamless and actually lowers costs and improves outcomes. So I appreciate that you have that approach. What drove you in that direction? Being an MD, I'm sure you came steeped in the same, Western background that I did.
Yeah, I saw that a lot of what we were doing wasn't actually preventing disease or addressing disease from a root cause. And Western medicine has its strengths. It's very technologically advanced. We have incredible surgical capabilities, and our emergency services are, really great. But there's a lot that we can learn from other healthcare models. And I saw in global health work that we were excluding traditional healers in the area and creating a kind of us versus them dichotomy with a lack of collaboration, and that isolated patients even further. And we could, by having a partnership with other it doesn't have to be that we're promoting what they're doing or saying like this is evidence-based. It can just be a partnership and a respect and collaboration. And I think that would help us to understand our community's needs better and to actually work together to address those needs. So that's where that came from. I feel like there's so much that we can learn from other systems and other ways of healing. So just being open to that is really important.
And I'd like to just add that to what you were saying, Athena, what I have experienced with my no healthcare background, but traveling to other countries and experiencing some of the things you have, we really need to, there's a lot of people in, this is just from me, a lot of people in medicine who are doctors. And when I decided to do what I did with my place and take people from Jerry psych wards, and most of them had a big history of very dangerous behavior. And but what I learned was that as elderly people, and I'm one of them, so I know as I've gotten older, I've had more doctors, and I got a specialist for this and one for that, and they don't talk to each other. Which, when we took our people, there was no way we could get a straight answer from anybody, because a lot of their specialists didn't talk to the other specialists, and it took us 6 months with 4 of my nurses trying to get the right information for these people, because we were taking them off of psychotropics. And in order to do that, you have to have an understanding of what's been happening, prior to them coming, to be successful at it. And, but I think we need to focus more on, when I've heard you and many other people say, we don't spend enough time trying to find the root cause. And, Dawn, I had a pretty long conversation with Pat in St. Cloud. And he said that he remembers, he looks almost as old as I am, maybe he's not, but maybe we have to focus more on getting to the root cause and preventing these things that we have an opportunity to prevent. Some of it you can't, but we need to focus more on prevention rather than the expensive treatments that maybe not everybody can't afford. I mean, I'm supposed to be on Eliquis, and I haven't had it since January because I'm on Social Security, and I can't afford a $400 copay for one 30-day medication. And, those things, and I'm more worried, like maybe Lonnie talked about, and everybody knows about it, but nobody is real open about talking about it. But the chaos and the changes we're having in this country, none of us know. I mean, if I don't get my Social Security check on the day I expect to get,
Oops, somehow you got muted.
I didn't know how it got that way. I guess I was going around with my cursor. But I just want to say that as a non-healthcare person background, you see things that people that have a certain special degree, you see, as much as they want to do it different, they still get tunnel vision, especially with specialists. And, now I'm 81 and I have, 7 doctors where I used to have 1 or 2, and I realize that it's for my own health and benefit. But
I think you're right. You're definitely right, Judy. It's the silos we've been talking about, and that lack of communication. That's a big part of what's going on. I noticed that Marty was shaking his head pretty vigorously during some of these conversations, and I'm wondering, Marty, if you had any comments you wanted to share.
Yeah, I'll jump in a little bit. And I hope I'm not out of line or anything on this. Honestly, I'm not totally sure how I ended up here. I'm guessing it was probably through connections through LinkedIn and everything else. So I saw this and I thought this was interesting. to look out. I'm in a startup industry. I should be retired from the medical. I spent 37 years in the device side of the industry, and now I'm involved in something that I'm trying to change healthcare as we know it today. I may be tilting a windmill that's crazy. But look, I love the mission of a lot of what I heard today. Of the three speakers I heard today, I love where all you guys are going with this and sort of what you are trying to address. But I think that the reality and one of the problems in America, and especially in healthcare today, is not the answers that we get. It's the questions that we're asking. We're simply not asking, the right questions and even addressing it. And, the gentleman that was talking about Medicaid, and how we fix Medicaid, going to the providers and going to the hospitals to try to fix Medicaid, for so many of the people that we're trying to talk to on this, it's broken for us, but it's not broken for them. Right? So the people that we're asking to help us fix the system, it's not broken for. There's a gentleman that I follow and spend an awful lot of time with that just couldn't have said it better. The system in America as we know it right now is not broken. It's rigged.
Perfectly.
It's rigged to take care of the people, that are in power. The common thing I heard from three people today that I personally think, and this is what I'm doing, if I can help any of you guys on your journey, and if I can be a resource or connect, I've got connections and stuff, I'm happy to do it for those type of things. But the reality of it is, right now, everything in healthcare is looking at healthcare from the revenue down. And that's just a broken model. If we want to fix healthcare in America, and basically anywhere in the world, but America within our communities, starts looking at the patient and fixing it up. And that's why I like all three of your presentations. The thing I liked is it came from, or as I listened to it, you're looking at healthcare from the patient. And we need to include in that the patient-physician relationship. And if we start there and then we build up, we'll quickly identify all the garbage and BS that's draining, the system out. I think for Zena, especially from that end of it, the road and the pathway to do that is most likely through HR departments and employers. Because at the end of the day, you have to get to the people that are actually writing the checks to pay for health insurance. And if the education level is going to happen, we've got to educate those people onto why the traditional model of you guys spend $26,000 to quote unquote provide somebody health care, which is insurance, which then gets these people a $6,000 or $7,000 deductible if they're in network, and most of them can't even then afford the $6,000, to go receive the care and stuff that they get there. It's not solving anybody's problem. It's not fixing it. So I don't know what the solution is or how to help all you guys. If I have contacts or connections and everyone wants to chat and I connect, I have a large Rolodex of people. I'm playing in a world where there's a lot of people looking to invest. There's looking for people to try to change healthcare. But my 2 cents is we got to change it from the bottom up, not from the existing system down.
And I'm not sure whose hand went up first. Paul was Keely. Okay, go ahead.
I just want to say really quickly, Marty and Judy, both of you, I think one of the biggest ways that you can help is just to continue adding your voice to the conversation, because we have a lot of people, like you said, within medicine talking about the problems within medicine, but without the perspectives of someone who hasn't come up in medicine. And I mean, anytime funders, you're a good connector, Marty. And I know I would be happy to chat with you more about what type of things they would be interested in investing in. But I think, was it Judy who was talking about the craziness that's happening in the world right now? I really think that it's both outrageous and an opportunity, right? Because the outcry that is happening right now is starting to get some real movement in the right direction, whether it's people standing outside of Tesla dealerships or whatever other way they're starting to become vocal. People are pissed off, and pardon my French, but that's where we need to be if we're going to start moving things in the right direction. And I hope that we can piggyback off of that energy, because the truth is healthcare is so deeply intertwined with all the other issues we're having with government right now, that if we can get our message strong enough that it can get into this rhythm, that we might actually get somewhere in the near future.
Thanks, Keely. We have 2 more hands up, Paul and then Susie. Oh, you're muted, Paul.
Real quickly, Marty, you just qualified for membership in HRC because you get it. That's exactly where we're at. And what we're trying to do is start from the bottom up and create a grassroots movement that reconstructs healthcare on the basis of the caregiver and patient relationship. Secondly, I want to connect you to Health Rosetta. Look it up. It's run by Dave Chase, who used to run WebMD. It's easy to find. Just look at Health Rosetta. They're talking about what you're talking about. Lastly, quickly, networks grow at the speed of trust. I already trust Lonnie Hirsch. Lonnie and I know each other, but I didn't know exactly what Lonnie was up to lately until today. So I'm meeting with him tomorrow. That's how this works. I have a bat Rolodex in Washington State. I know a bunch of people, and I know how big the hit's going to be to our state, and I think I can help Lonnie. I'm going to jump in and do that because of this meeting. That's it.
Well, thanks,
How it
Paul.
works.
Susie, we'd love to hear from you.
Hi there. Marty, you inspired me to speak out because I am here because I've been following Denise, but feeling like, oh, I'm an outlier. I'm not part of the meeting officially. And she welcomed me. But I'm here because I am a learning strategist. So I use instructional design as a tool for change. And I just want to thank all of the three speakers here because you really inspired me. And I always say the people I like to surround myself with are loving disruptors. And that is what I think all of you count as that. And it's heartening to me to hear your specific solutions. And I just want to just put out there that if teaching and learning, taking a complex topic and making it simple and putting it into a format that people can take action from, not just have vomited information to them, but then actually do something with that information. That's what I do. So if my question for anyone is how can learning design help with these major issues that feel so overwhelming, and put myself open for a conversation with anyone who wants to talk about that. And I want to support your work collectively however I can. So thanks for letting me join in.
Thanks for joining in, Susie. That was a big contribution. And this is the radical collaboration that we're here for, right? This is such a great example of that. And we're going to, before everybody leaves, we're going to jump into network conversations for the next 30 minutes. If you haven't been involved with that before, it's an opportunity to be in a breakout with one or two other people, exchange contacts. It's about 6 or 7 minutes that Denise will throw you into a breakout with other people. And it's another opportunity to connect on a more personal level. So if you're not going to be able to join us for the next 30 minutes, hop off now. Otherwise, stick around and we'll see you in a breakout. Thanks, everybody, for joining us today.
Yeah, thanks for the presentations. Those were interesting. I've got about another 15 minutes I'll hang around, then I got to jump into
Perfect.
another.
Excellent. Thanks, Marty.
All right. So right now I have 5 rooms.